The Grillers on the Rebel.
It's Scotty and Cleggy. I've got a proud Scotty sat across from me because he's just won his first Smarter Than Shrek, which is very impressive. Mate, we've got an amazing guest here. We touched on it early on. Dr. Grace from Brain Aid Clinics in Southport on the Gold Coast. Thank you so much for joining us.
Thank you for having me, guys. Congratulations.
Thank you very much.
It's an absolute pleasure. You're also a gorilla yourself. Grace as well. So later on in the show, I think we'll talk about Gorilla Investments Group as well. But we're going to focus on Brain Aid Clinics because Rebel FM does a hell of a lot of work in men's mental health. We've got listeners with chronic pain, and I know something that you guys do is pretty groundbreaking. Can you tell us a little bit about the company and about Brain Aid Clinics and what it stands for and what you do?
We do advanced neurostimulation, which is a nice way of essentially saying that we stimulate the brain, especially in patients who have depression, anxiety, and chronic pain, in a way that maybe medication or talk therapy hasn't helped before. And we're really looking, as an outpatients clinic, we're really looking for those patients who are just trying to hold it all together. Like they've got dogs, cats, kids. So the idea of them going into a mental health hospital is it's just not tenable.
It'd scare the shit out of me too.
Absolutely, right? And, one of the initiating factors was a mate of mine running multiple successful businesses, checked himself into a psychiatric hospital and had another patient wander into his room late at night, and he was just like, what am I doing here? Like, I'm trying to run a business from my hospital bed and there's just people wandering in and out of my room. So he was like, Grace, please, can you create this outpatient clinic, essentially, and make it a private clinic, make it a great experience. And I already had a lot of experience with running clinics of different size. So I was a CEO of Coastal Dental Care,
right?
Through COVID, and that was a story in itself. But what I could see was that there was absolutely a need in order to keep people who were just trying to hold it together healthy, functional, and integrated into the community whilst still getting the best of care.
Because it's not just people go through dilemmas all through their life that create the depression side of the thing. You said the pain factor too, because that can do it. Because some people don't know where to look with that. Chronic pain can bring your mood down, everything down. You don't know where to go.
100%. And this is the thing, right? The government is supporting the use of this technology, which is called RTMS, or repetitive transcranial magnetic stimulation, which is a massive mouthful.
I wanted to be the first person to say that.
I've
been practicing it and everything. But go on, carry on.
In the shower too, probably.
I'm going to call it TMS.
Yes, that's a good idea. Thank you. So TMS is approved for treatment-resistant depression, and you're 100% spot on. Pain often induces depression. Depression also often coincides with pain. So we actually treat both at the same time.
Yeah, good.
Yeah.
Very good.
And do you treat anyone? I mean, we've got a lot of our listeners. I think a lot of males, in society. I suffered from depression in England, and I didn't find sertraline that I was taking did anything. I just needed to move to Australia, I think. And I hate to say that, but I was just very at rock bottom in my life. And I think if we've got listeners out there and they're kind of, a lot of people are reluctant to talk about it, what would you kind of say to them?
Well, firstly, I spent a year in Manchester, so I
get
completely get it.
Climate,
right?
it's awful, isn't it?
Oh my God!
I'll cross that off the list.
How much rain could you possibly have?
Exactly
right.
Exactly.
And secondly, I had postnatal depression and was on sertraline, and exactly that situation. You don't feel fantastic, but you don't feel terrible either. But I would constantly find myself just circling back to the fridge. I'd put on so much weight. Mainly because I just wanted to eat to feel something. And it was dissociating me from my kid who had just been born. This much wanted pregnancy, and you're on this drug, and you're like, how much of this is going through breast milk and affecting the kids?
And that can be affected too. And that's why people turn to alcohol and drugs and that sort of thing too, because that stimulant, they need that, that takes that pressure away.
Well, you self-medicate, don't you?
Absolutely.
And I did a lot of that, I think. And it's just... people kind of frown upon you because of your behaviour, but I think people don't realise what's going on behind closed doors, do they? And
100%.
Is your clinic? Is it for? You said off air that often it's a last resort because they've tried everything else. But what about people who? I know several people who are reluctant to take medication. They don't want to go down that path. Is that something that you guys can help with as well?
We actually came from that philosophy. So a lot of this teaching that we do, we do the neurostimulation, but we pair it with lifestyle modification. And the research is finally catching up with thousands of years of practice in Chinese medicine, hypnotherapy, hundreds of years, like there's so many ancient technologies that were essentially like, that's just woo-woo. And Western medicine, especially chemical-based medicine, just kind of discarded, right?
Yeah.
And yet, like if you look at my own personal journey where like IVF, only possible through acupuncture and a ton of medications as well, but the acupuncture increased the quality of the cells.
Right.
How does it do that? I'm not
Yeah,
sure,
wow.
right? Like,
Unbelievable,
but it was unbelievable, right?
Yeah.
And as a medical doctor, as someone who was like, I did 17 cycles of IVF, and
No
the only,
way, really?
no, seriously, and the only times that it actually took was after I actually changed into this particular acupuncturist who now is working in my clinic because she specializes in neural repair, musculoskeletal repair, and fertility.
You love the long words, don't you?
Bleh.
I must admit, just before we had Maverick, my son, my partner was going for acupuncture, and she loves all the alternative stuff.
Yep.
You're right about the American and the Western philosophy with the chemicals, and they have just kind of taken over the world. And I think it's time to almost take the world back, isn't it? And think we need to, go back to more simple, not simple things, but we can't be reliant on drugs all the time, can we? And
Do you know what the biggest thing there is, though? The profit.
Oh, absolutely, it is.
The profit.
It is.
That's what they seem to, that's just put it on a tablet because they make plenty of money out of it.
They do, and that's a problem, isn't it?
Well, a lot of the research that we are using as doctors really is short-term data, but then applied because it worked in the short term in a long-term capacity. And actually, if you either extrapolate those particular research or the absence of that research, there is no long-term studies perhaps on like, well, what do you look like 30 years onto sertraline, etc.
Yeah.
But in the 6-month period, very effective, right? So what you're looking for is essentially a long-term solution to what is a short-term kind of gain.
Yeah.
So, in fact, one of the things that is coming out, and there's a number of Congress-led investigations into prescribing for depression, etc. So this is coming out of the US.
Yeah.
Is like, well, what do you do with medications that are being used long-term? One of the reasons why TMS is actually it wasn't considered first line is because it's considered so expensive on a treatment basis.
Yeah.
But we're then treating patients who've been 10, 20, 30 years on depression medication. How much do you think that's costed them as a human and the government as well? Huge amounts, right? And we can take them from having like a PHQ-9, which is like a depression index, from like 10, 14. So doing okay, but still feeling that black dog at the door pretty much every morning, right? To 0, going out, playing mahjong, playing, like hanging out with their friends again, catching up, picking up the phone. And they weren't doing that when they were on all those medications. Yeah.
And the TMS, it's not invasive, is it? It's
No.
Can you just explain that to the listeners, the process of it?
Yeah. So if you've ever charged your mobile phone using one of those flatbed chargers in your car or something like that, rather than plugging it in, you use your inductive charger, which is a nice long word for essentially saying using a magnet to induce to charge it, right? Yeah. So I'm so reluctant to go into all the science of it, but essentially go into it. Okay. Yeah. So there's a guy called Faraday, Michael Faraday. Yeah. He of the Faraday's electrical cage. Right. He figured out that if you passed an electrical stimulation through a spinning magnet, you can actually induce a charge at a distance.
Wow.
And it can and it's lossless. Like you essentially start it here and it ends up there. Yeah. Same principle used to charge your phone. Mm-hmm. Same principle if you apply a magnet against your skull, you don't lose the charge from going out of the magnet into the actual neuron. So it has to find a conductive piece of tissue, like the neuron. Yeah. And it changes the way that the neuron fires. Either it increases it in the case of depression or it decreases it in the areas of anxiety, for example.
Wow.
Yeah. And it's so cool if you think about it, because ECT was the previous standard for severely depressed, like suicidal people. Yeah, wow. And out of Stanford, Nolan Williams is using this type of technology. 5 days straight, he can take someone who was acutely suicidal to not suicidal.
Yeah, unbelievable.
Amazing, right? Yeah. So, and this is the thing. So our technology can do that. You have to be prescribed that, of course. So our psychiatrist may choose not to. Yep. And as an outpatient clinic, we are not equipped for acutely suicidal people, patients. Please go to your acute medical unit or your emergency department.
Yeah, very
if this
good.
describes you.
Absolutely. And then on the polar opposite of that, I suppose, is the people that get everyday anxiety. Now, personally, I think I mentioned to you a while ago that I've started taking hemp tablets because it's just natural, isn't it? And really worked with me. I used to come into the studio, if I'm interviewing a celebrity, I'd be really nervous, anxious. Now I just don't really get it, although Scott, he'll probably say that I do sometimes because I get a bit narky. But how do you feel about, medicinal marijuana and the hemp that's really kind of taking off?
Oh, I'm all for it.
Yeah.
So I've actually qualified as a medical cannabis prescriber.
Yeah.
It's not something that we do through brain aid clinics.
Yeah.
Obviously, you need a really comprehensive way of thinking about it. In Queensland, there's driving laws and there's a whole bunch of different restrictions around it. But a number of my pain patients are actually on medical cannabis, but they're still needing a change in the character of their pain. They really aren't. They're finding kind of like temporary relief, but the actual change of the pathways, the neural pathways, is not really happening with it. And that's what we're doing. We're changing the electrochemical, kind of like the railroads in which the train runs. Does that make sense?
Yeah.
So if we affect structural and functional neuroplasticity. What does that mean? It means that we change not just what train is running on the train tracks, but where and how those train tracks are directed.
Awesome. Well, Dr. Grace, I could talk to you all day long, and I'm going to try to. We're going to keep you for the last part of the show, if you're happy to stay with us.
Yes, I am.
I've seen you present. I know you're an incredible entrepreneur, and I'm not just saying that. So I think in the next part of the show, we'll talk about Gorilla Investments Group. We've got a fellow gorilla here.
Unbelievable, hey.
Scotty, but it's spelt Gyrilla.
But I must admit, I'm enjoying this first part of this show, this chat. This is amazing, because I'm learning stuff that I've never ever thought about and gone through. This is really great.
It's a bit different from what we do, but it's so important for our listeners, and it's a lot of listeners will really kind of engage with it, and I think hopefully we might inspire people to get treatment themselves because that's what it's all about.
And get in contact with Dr. Grace.
Absolutely,
please.
get in contact. But
The Grillers on the Rebel.
Dr. Grace has kindly agreed to stay with us, which is really nice. Which is lovely.
Thanks, guys.
We're really enjoying talking to you. So, as we've touched upon earlier, Gorilla's Investment Group, I've seen you present to a whole bunch of people, and you pretend you're nervous when you come into these situations, but she's great, isn't she?
She doesn't look it at all.
She doesn't look
Having
it
the time of her life.
Tell us a little bit about Gorilla and Gorilla Investment.
So Gorilla Investments Group does three things. It does courses on scaling, it does consulting, and it also does capital raise, which is essentially bringing money into a otherwise scaling or post-revenue business that wants to do more.
Yep.
So more overseas, more locally. We do tend to specialise in health and care businesses. So health like biotech, med devices, med software.
Yeah.
And also care. So, for example, one of our clients is a childcare network that's coming into Australia, for example.
Yeah, good. Excellent.
Awesome. Love it. Tell us about yourself then, Grace. Obviously, you run a lot of different businesses. You're a doctor. I don't know how you stand still. You don't seem to stand still, to be honest. But, tell us about what makes you tick when you're not in the work environment.
I'm currently medicated on Vietnamese coffee, so.
And guess what? We're going to be medicated after this show. We're going to have some beautiful crispy pork. Was it that you brought in?
That's right,
Can't wait.
Exactly.
Yeah, that's
gotta feed you guys.
Making us very happy, I must admit. But yeah, what do you do in your spare time then, Grace? Obviously, you told me you've spent a lot of time in England. Where I'm from, we don't particularly like the weather over there. It's much better here. But what do you do around the Gold Coast? When you're not working.
I do miss the jam donuts, though. Have not been able to find the jam donuts over here.
Really?
Yeah, absolutely.
I've never looked for the jam donuts over here. I didn't know.
Personally.
Yeah.
Well, I'm a mother to 3 boys.
Yeah.
So right now we're going through a Sonic the Hedgehog and Spider-Man phase.
Yeah.
And so life seems like a process of getting energy into them and then just taking it out of them as rapidly as possible, right?
Yeah.
And then somewhere between they sleep and possibly I sleep as well.
Yeah.
So yes, it is really busy, but I'm super passionate about brain aid clinics and my clients. So I really take on projects where it speaks to what I've practiced for a very long time, which is that democratization of access, access to care,
yeah,
and building the fora where entrepreneurs and people with clinical expertise and people who actually have their own distribution networks all can kind of come together and mingle and share those ideas. So did that previously in Melbourne, helped build up like Startup Health Tech, one of the largest gatherings of health tech entrepreneurs. Wow. And from there actually made investments in medical cannabis very early on, tapped to be an advisor to those kind of organizations.
Awesome.
And my clients have gone on to win AFR awards and, best distributor awards, etc., kind of thing. And I'm so proud of them. Their awards is actually like we're very much back of stage. We're not like, hey, let's rah rah kind of thing.
Your support network.
We are. We're the fibrous tissue, man. Like seriously.
Absolutely. But it must be so rewarding for you when you're working with these people and then they go on, you help them in the embryonic stages and then they go on to achieve such amazing things.
That's it. I'm really, really pleased and proud. And more importantly, I love the people that I get to bring together on that road.
Yeah. Now, how do you feel about AI? Now, because we've got mixed feelings. I don't get me wrong. It's some of the stuff they do is absolutely fantastic. Mm-hmm. But for me, I'm an English graduate. Used to be a school teacher, and I love writing.
I'm not.
I love writing. I love writing. I love talking.
Spell that shirt.
I love writing. I love talking. I love being creative. And for me, oh God, it's dumbing it down a lot. But I know in some areas. Am I right in thinking when I saw you present that you use AI a lot in what you guys do?
We do. We've got a challenge for ourselves and our clients, which is that I totally believe with AI, you could build a $10 million business with
let's do
10
it.
people or under. With 10 people or under, it's absolutely possible.
So two gorillas.
2 gorillas plus a third consultant.
Let's talk about it.
Exactly. No, seriously. So I think AI is going to be as revolutionary as like the light.
I agree. I agree.
People where there was a whole bunch of people who had jobs lighting the gas lights, etc., kind of thing, and shipping oil and whaling and blubberings, and those industries were essentially decimated within a decade. And I think that it's as big a change as that. And it's also going to change. What do we educate our children? How do we actually think about the apprenticeship system? How many of our roles, from lawyers to radiocasters to writers, are all on apprenticeship. So hours spent at the coalface reading through law journals. Don't need to do that anymore.
No.
Reading through chest x-rays. Well, the law on that, we can go into that a little bit more with doctors, right?
Yep.
But that time at the coalface is changing.
Yeah, it is, yeah.
It's rapidly, you can fool a number of the different systems in which we actually give the authority to be a prescriber.
Yeah.
And actually a couple of weeks ago, one of my favourite podcasts, the All In podcast, one of the presenters there also said, hey, wouldn't we just get around this if the AI can actually pass all the exams that would otherwise be required?
Yep.
And you've already seen that in radiology, for example. And I just sent about 12 days ago, they announced that an AI has been approved as a physiotherapy app to diagnose and treat.
Yeah.
Right? I mean, all of these things are going to change the nature in which. So everyone who says this is not going to affect my industry, actually, I don't think there's an industry that won't be affected.
No, I agree. Yeah.
And in particular, things like industries like nursing, where they're like, oh, nurses will always exist. Yes, nurses will exist, and you're seeing this in the NHS. What they do is going to change because guess what? It's super expensive in order to train and maintain a doctor. Far cheaper in order to have an AI that's approved and passed all the doctor exams and run by a nurse.
Yeah.
Right? And then centralised.
Well, I did see on the news one night there was a robot A1.
He calls it A1 sometimes.
A robot that was actually in the old folks' home. And it was doing the exercises, and the patients or the residents were actually following the movement. They're saying, this is the way it's going to go. So you don't need that therapist there. You just got this robot teaching the people how to move properly.
Yeah.
So on the commercial side, so many challenges in services businesses is around people availability, right? Like, so one of the biggest challenges that I had as the COO, then CEO of a dental network is, well, dental assistant didn't show up. What's the dentist going to do? It's really hard for them to do it. Or in cases like surgical assisting, where medico-legally you're actually required in order to have that assistant surgeon. What happens if they're sick? They don't turn up. So what you're having is essentially staffing solutions essentially solved either by a robot or by an agent. And we do actually have a training course on AI for scaling because teaching people how to think about, well, what is the right time in order to bring a robot or bring AI code into the business? Some people do it far too early and blow a stack of cash on this. I'm seeing $40,000, $50,000, $60,000, even $100,000 in order to do it, and like
just to try and get ahead of the game.
Just to try to get ahead of the game.
Yeah.
But then if you go backwards and you look at that company, they're not ready to scale, and they're not ready to crystallize that particular business function into it. Or worse, like look at what happened with CBA, fired the entire department, right, of people answering phones, and then, oops, they had to hire them back again because it's stuffed up. Yeah, and people hate talking to robots, right? So what part of your business do you have to actually replace, right? They could never imitate the warmth, they say, of radio interviewers. And yet when you look at Notepad, what have they done? They've taken a script and they've made it a 2-person podcast. Yeah. Still doesn't pass Uncanny Valley, but it will eventually.
Yeah, that's right.
My mind is, you're very passionate, and I love it. And I think
I need some crispy pork.
I think
let's do it.
Certainly do. I think
blood sugar's getting low.
With AI, we kind of got to tread carefully a little bit, and I think there's a few dangers out there, but I'm totally with you, and I think we can't hide from it. And I think it's going to be just so revolutionary. Unfortunately, we've got to wrap it up for today.
Just quickly, just how do listeners get in contact with the TMS?
Yeah, absolutely.
TMS is info@brainaidclinics.com.
Okay.
No AU.
Perfect.
Thank you,
or
Scotty.
Just look up Brain Aid Clinics.
You should be this side of the desk, mate. I've always said it. Dr. Grace, I really hope listeners that are in need of something will reach out to you, because you're absolutely fabulous. And thank you so much for joining us.